Ja, guten Abend und herzlich willkommen zu unserem heutigen Webinar in Kooperation mit INDIBA Health zum Thema Verbesserung der Leistungsfähigkeit und Wiederherstellung bei Verletzungen von Pferden mit Hilfe der Radiofrequenztechnologie. Mein Name ist Holger Neusnick von der Firma Physia und wir freuen uns sehr über die große Resonanz zu diesem Thema. Die Leitung des Webinars wird heute Abend Hannah Ashton aus England und Dr. Bruna De Vita von INDIBA aus Spanien übernehmen. Sie haben die Möglichkeit, am Ende des Vortrags oder auch während des Vortrags Fragen zu stellen. Dafür haben Sie eine Chatbox am rechten Bildschirmrand, in der Sie die Fragen quasi eingeben können. Darüber hinaus können Sie in Ihrem Webbildschirm auch Dokumente, Studien herunterladen, die Sie interessieren. Und genau. Ich würde jetzt vorschlagen, dass wir ohne weitere Verzögerung starten und übergebe an Bruna De Vita von INDIBA Health. So, Bruna, you can start right now.
Hello, everybody. Good evening. Thank you, Holger. So as Holger told you, my name is Bruna De Vita. I'm a veterinarian and doctor in veterinary medicine, mostly working with regenerative medicine and stem cells. And currently I'm the vet clinical and training manager at INDIBA. And I'm pleased to be here today just to give you a quick introduction about INDIBA technology, and also the scientific background about this radio frequency device before Hannah starts her presentation. So INDIBA is a company founded 40 years ago and focused on the development and scientific-based devices of radio frequency for medical, aesthetics, physiotherapy use, that more recently, 5 years ago, also launched the veterinary division. During this time, INDIBA has perfected its technology, which is based in a fixed and specific frequency of 40-48 kilohertz. That it's the magical number of INDIBA. Got 12 patents approved, was recognized with 50 international awards, and nowadays count on more than 400 medical references among theses, papers, case, and clinical reports, which endorse its beneficial effects. But what's the therapeutic radio frequency and why 40-48 kilohertz? So radio frequency is an electromagnetic current applied over the skin to generate a therapeutic effect in the target tissues. And the classical effect of any therapeutic radio frequency is the thermal effect. So in other words, the thermal effect is the increase of the temperature of the tissues. The benefits promoted by these thermal effects are very well described for several authors and known to promote a lot of beneficial effects, such as the local vasodilation, the oxygenation, the drainage. Analgesia is one of the most known effects of the thermal effect, and also the release of heat shock proteins that currently are known to have main effects on promoting cell homeostasis. However, However, after years of research and development, students have shown that INDIBA radio frequency at this fixed and constant frequency of 40-48 kilohertz, besides the thermal effect, also present an electrical effect, which is not temperature dependent, but frequency dependent, and which has shown to trigger a cascade of effects at the cellular level, which will help to restore the electrical potential of the cells and the extracellular exchanges, resulting in different therapeutic benefits, and as shown in several studies that we carried out over the last years. So I've selected some of these effects, these studies that we see, that the electrical effect at this specific frequency promote, for example, the proliferation and differentiation of mesenchymal stem cells. You know that these cells are a key population of cells in terms of regeneration and immunomodulation on damaged tissues. Also, studies have shown that these electrical effects were able to promote the production of collagen 2 and extracellular matrix production when chondrocytes were exposed to that. That's very interesting when we are talking about joint lesions. And also, the third one that I would like to mention is the one that shows that these electrical effects also promote the fibroblast proliferation and also increase the skin regeneration biomarkers, which is extremely beneficial when we are talking about wounds or when we are talking about post-surgery treatments. It also has shown to increase the microdrainage, and all of these effects without increasing the temperature. So that will allow us to treat both chronic and acute lesions. Why? Because when we are treating acute lesions, usually we don't want to increase the temperature of the tissues. So working with low intensities, we can provide these electrical effects that are going to be beneficial to benefit the acute lesions, and we can start the treatment from the day zero of the lesion. It's also important to mention that when we are working with thermal effects with INDIBA, we are adding the effects of the electrical or subthermal effect. So with that, we can optimize the physiological mechanisms of healing of our patients and help them to recover faster. Another important aspect to mention about INDIBA is that it works in a closed circuit. And that is super important to us working with horses because it allows us to achieve very deep tissues. For instance, as the sacroiliac joint, that it's very difficult to achieve with manual work or with manual therapy or other modalities of therapy. So the current is emitted by an active electrode, the one that you can see our colleague applying in the back of the horse. And then this current will travel all the body down to the return plate, that is the plate that is usually placed in the external area of the horse. So it's also known as capacitive and resistive electrical transfer therapy because it counts on two different modes of electrodes, the capacitive that usually concentrate the energy more in superficial tissues, and also resistive electrodes that are more indicated to treat deeper tissues. In almost all of our protocols, we start using the capacitive because it allows us to prepare the superficial tissues and use it as a primer to open the way for the current to go for the deeper tissues that we are treating. So as I told you in the beginning, nowadays we count on more than 400 medical references which endorse these benefits. And it made us very well recognized as an excellent tool to reduce recovery time and also to enhance athlete performance because it can also be done with sound animals or sound persons. That's why it became a therapy that is used for a lot of top-level athletes as Rafa Nadal, Lionel Messi, other Olympic athletes. And some time ago, a lot of veterinarians or veterinarians research started asking, what about horses? Because we know that horses are very good athletes. What would happen if we apply INDIBA on our horses? No? So the results of this first study that was performed in Italy was really spectacular. So the company decided to open the vet division, and we start first with our first device for horses in 2017. 2 years later, we also launched a device for small animals. And last year, we launched the ECHOS device. That is the first device that was really 100% developed for the equine environment. So with all these years from 2017, we could learn from the experience of the vets working with us, as Hannah is today, to give us the feedbacks and what we could improve in this device. So it's a much more portable device, very light, very easy to go to visit your clients in different locations, and with a lot of new technology too. So let's check some of the studies that we already performed with horses. So I would like to share with you very briefly some of the studies that were performed. The first one is the one that I said that was performed in Italy already a long time ago. The first one that we saw that this device could be very helpful also to treat horses. And it was performed with 115 horses with tendon and ligamentary injuries. And they observed a clinical improvement in 85% of the animals and an effective reduction in the recovery time. Not only that, with the scanners, they could see also the quality of the healing was really good. You know that it's very important, the quality of the healing, especially in tendons and ligaments, right? So to prevent the relapse of these lesions. The second one that I would like to mention is the one that one group from the Cordoba University here in Spain performed with horses with thoracolumbar pain and compared with sham procedure. Sham procedure is a procedure like a placebo. So they are performing the same treatment, but with the machine turned off. And they saw a significant reduction in the degree of the thoracolumbar and epixel pain, and an increase of dorsal ventral power at walk and trot. So they started thinking about, and what if you treat animals that are sound animals, that are performing, that are participating in competitions, what we could see? It could be beneficial too. So they performed a third study where they saw that with accelerometric evaluations, they saw a great total powers, increased dorsal ventral and major lateral and longitudinal powers were greater, and also the stride length were longer, right? So the horses could cover more distance, giving less steps. That's a very interesting characteristic. So the other thing that they saw is that the results were even better when they treated the animals more than one time. So the second time that they treated the animals, the results were even better, showing that it could have also an accumulative effect beneficial for these horses. There are also two other studies presented in the last congresses of the European College of Veterinary Sports Medicine and Rehabilitation that showed that the treatments also had beneficial effects on dressage horses and trotters. Let me remind you that you can find all these studies in the box that you have in the left side of your screen to download it, or on our webpage too. Besides all these clinical studies performed and already published, we have many different case reports from the vets who are working with INDIBA, and we have beneficial effects in tendons, ligaments, fractures, wounds, trauma, back or cervical pain, kissing spines, problems in the knee, in the hock. So in all of these situations that are very prevalent and very common in our environment, we can see that INDIBA can help the recovery time and also the quality of the healing of these structures to keep their functioning very well. We still have 5 clinical ongoing studies, so very soon we are going to provide more scientific data that endorse all these benefits. So just to conclude this very brief introduction, As you could see, INDIBA is a great therapeutical tool that can be used both for recovery and rehabilitation, but also for performance improvement and to prevent lesions in these animals that are under treatment, under training constantly and suffering a lot of pressure in these musculoskeletal structures. It will help us as general effects to the management of acute chronic pain, also accelerating the tissue repair, and for athletic animals, it will help to improve the performance, but also to recover post-exercise. And of course, overall, to promote the relaxation and the well-being of our patients. So here you have a small picture of our new device that, as I told you, it's a device that it's very thought and designed to be a device very useful for our practice day by day. We have in this device a lot of building protocols, so it's very easy to use. All of our clients also receive a full program, both theoretical and practical program of training. But today, our goal here was really to make it to see how is it in the real life, right? That's why we invited Hannah Ashton, who is an expert in vet physio based in UK and one of the pioneers using this technology to share her personal experience, her cases, and how it impacted her practice. So Hannah, thank you very much for being here. I will let you take you over from here. And Hannah, are you there? Yes, thank you.
Hello, hello, I'm here. Hello, everybody, and thank you for attending the webinar. As Bruna said, my name is Hannah Ashton. I have been a veterinary physio in the UK for 14 years. I used to be a veterinary nurse, so I worked in clinical practice for 3 years, and I've ridden horses all my life, well, for 30 plus years. My work has pretty much gone, I would say, 100% equine now. I am qualified in both dogs and horses, but all my work really is in horses. And I work in a lot of horse racing yards, dressage yards, hunting and showing yards. I have a few eventers, but only a few. I'm very lucky to be based in the Cotswolds, which, if you've ever been over to the UK, is full of green fields and hundreds of horses. So there is not a shortage of horses that need treating. I got the INDIBA device just under 4 years ago, and it has transformed my practice. I used to use ultrasound, laser and TENS, which I got along with fine, but the results I get from INDIBA are far greater and far more impressive than I ever had with my other electrotherapies. I do still very much use manual work as part of my everyday treatment alongside INDIBA, and it is important that is used alongside the INDIBA treatment to get best results with certainly some muscle cases. So what I wanted to share with you from a practical point of view is how I use INDIBA in my day-to-day practice. I just wanted to highlight some areas where I focus my treatments. I think it's very easy sometimes to just focus on the back of the horse, but it can be used everywhere, really, with great results, from treating injuries old age, and performance. It can cover pretty much every area of the horse. So I've split it into sort of short segments, starting at the bottom, working our way up. The coronet band, I have actually started to do a lot more treating. We have sometimes I'll have a case where the horse has been lame for a number of weeks. They have had the vet to x-ray, they have done nerve blocks, they have done scans and found nothing to understand why the horse is lame. Because with INDIBA it's a closed circuit and you have your return plate attached to the sternum, by treating the coronet band, you will send that radio frequency up that entire front limb back to that return plate, and you can affect the structures all the way through the front limb. And I've had cases where the horse has gone sound. We don't know where the issue was because no diagnostics indicated. But the horse has become sound after a 4-week course of treatment, and it has stayed sound as well. I have also found when we have injuries, swellings, or arthritis around the knee, the carpus joint, treating the coronet band has been much more useful than treating directly over the knee. Again, because a lot of practitioners are used to using laser and ultrasound where you have to treat directly over the area that's got the problem. You have to remember with INDIBA, you treat generally below the area where the problem is, or behind it or in front of it, depending on where it is on the horse, because you are always looking to send the frequency through the affected area. We do have a short video. The only slight, I wouldn't say problem because it's not, but it is a trickier area to treat because of getting the connection. INDIBA, the radio frequency, it likes to attach itself to wet tissue or good blood flow to find its way back to the return plate. And when you're treating the lower limb, where there is no muscle, then it sometimes can be a bit harder. So I have attached a video which we will click onto in a moment, and it just shows the way I treat. Okay, so we're doing the coronet band, classic coronet band, no connection. We're not getting a connection because, assumingly, no muscle down here, poor vascularity. We're not getting anything around the heel anywhere. So we're going to come higher up the leg. Hopefully you heard the beep. We've got a connection now. We're just going to work our way down the leg. You might have to go higher up the leg on some horses, and you can work it down. I have put water, I have put gel all the way down here. I'm going to come all the way down, and we've still got connection. And then we just hope the horse stands still. And we can just keep going all the way around the heel. Oop. And there we go. Perfect. I hope you had some sound with that. I had sound my end. If you didn't, it showed how you would start higher up to get a connection and then work your way down. And that's the best way to achieve the results. The diagram on the right-hand side of the slide just shows how the red line just shows how the frequency will come up the leg, and then the circular object is supposed to be the return plate. And at the bottom, you will see that the new device, the Equus device, does also come with a return plate that you can wrap around the leg. If you want to keep your frequency localized. So in this image, I suspect she is treating a tendon, and she's only wanting to affect the tendon and not go higher up the leg. So you're keeping the intensity quite local. I also attached a picture of the vet lotion because it can really help alongside the gel to get connection. We can go on to the next slide now. So the neck is another really useful area I use to treat. I use a lot for performance in the race horses. You often get quite a lot of muscular tension in the neck, but also if you have horses with arthritis in the neck, horses that have been lame in the front limbs, they often get tight and sore in the neck to compensate for the lameness. But it's really shown to improve flexibility in the neck, softness in the neck, and it has improved, as far as I can see, front limb movement because they just become looser. So again, showing the line on the image, you will see if you're treating through the neck, the frequency will choose to go through the pectoral muscle back to the plate. It wouldn't choose to go around the outside of the scapula because that would be greater resistance. So by treating the neck, you're going to affect the muscles in the neck as well as down through the shoulders and into your thoracic sling. And I like to combine, your forelimb stretches and your carrot, we call them carrot stretches in the UK, where you ask the horse to bring the nose round to the shoulder and then further back to improve range of movement. The chest has also been a fairly new area. Although I've had the device for 4 years, you still discover really useful areas to aim the treatment. This image is of actually a young horse. The horse is only 4 years old, and the owner was just finding that as he's introduced to work, he was just getting very tight, and then his behavior would become, tense, and he would spook at things. And so he was finding that he was just shortening his stride and just not going forward. So we've done a course of treatment with this particular horse just to try and help him relax. And the rider has found that the horse is really relaxed, and the contact in through the bit is better, and the stride length is better, and it's also affected the suppleness through the neck. If you have concerns about the neck, then obviously you can treat higher up, but I would incorporate the chest muscles and down into the thoracic sling as well. And again, loads of stretching afterwards. When you have lovely heat in the tissue, you can really stretch them and get them moving and make them more supple. The pole and the TMJ, the mandibular joint. So with the pole tension, the first image where I'm over the temporal muscles of the horse, that is to show that sometimes there are horses that don't like you treating behind the ears. With those horses, you can treat in front of the ears, and they tend to be less worried, and you can then send the frequency through that pole and the first joints and down through the neck, just to help with suppleness. And then again, you would follow it with your manual physio work. With the TMJ, horses that have had dental issues, teeth problems, or they are particularly tight or strong in the contact, or have had any other problems around the mouth, I found it really useful to get them to soften in the contact. If they have known arthritis in the joint, again, they respond really nicely to it. And again, I've not had any horses that I can't treat. So they are really, really useful areas to treat. And again, the horses really seem to enjoy it. Hamstrings, just going further back on the horse. Again, more of a performance treatment. I use a lot on the race horses. They get very tight in their hamstrings. And where I have the electrode on the picture of the horse is often where I will focus my treatment, because you're going to send the frequency all the way up the hind limb and back to the return plate. And from experience, just focusing there, if I found the horses tighten its back before I treat, and then you feel the back again after I treat, I feel that there has been a change and the horse is softer. So I can only assume that the horses, their frequency has gone through that lumbar muscle as well and softened the back to get back to the return plate. So looking at the structures you can affect in its path back to that return plate, your hip joints, your glute muscles, your SIJ. And like I said, it's been really good for performance, as well as any horses that have maybe arthritis in the hocks. You can treat, if they are very tight there, you can treat there as well as incorporating the hocks into a treatment. Okay. If obviously you're not concerned about the hamstrings, you can start higher up. And with the SIJ, I will always start quite far back. Again, with other modalities, you would aim to treat directly over the sacroiliac joint, but with INDIBA, you want to be sending the frequency through the joint. So you would be aiming your treatment pretty much around the tuba ischiae or the glutes, the gluteal muscles, and send that frequency through there, through the SIJ and the lumbar muscles. I attached the image below just because it showed a horse that was quite overdeveloped in its superficial gluteal muscles, but quite underdeveloped through the biceps and the hamstrings. So we're just working on that to balance the muscle out, and I'm focusing my treatment far back through the tuba ischiae and up towards the sacrum. And again, I would be fairly comfortable that it will go through that sacroiliac joint. We've been getting really good results with that. So I included in the presentation plate positioning. We, most of the time, 90% of the time, you will treat, as the first image shows, with the plate on the sternum. It's the easiest area to attach the plate, and you don't really need to worry about it if the horse moves. It's nice and flat, so you get great contact. You will always want a minimum of 50% contact of the plate to the horse. Otherwise, you can get increased intensity on the area that is in contact, and it can heat up quicker, the plate can. So that's where we would generally put the return plate. However, there are some cases where you can't attach the return plate to that area. The second photo where it's attached to the neck was because the horse had an injury to its wither, and it didn't tolerate having the surcingle placed around the wither. So we attached it to the plate, to the neck, and it worked really well. Again, it's a nice flat surface, so it was fine, and we got good contact. The other plate position is on the ribs. We can use that for young horses, so foals, or small ponies that are very narrow in the sternum, and you might not get that 50% contact. So we can place the plate on the ribs, again, a nice flat area. In this case, obviously that is a much bigger horse, but that had a hematoma on its pectoral muscle. So I wanted to treat around the pectoral, so I moved the plate up so the frequency would go up that way. And then the final picture is of the equus plate, the plate that comes with the equus, which you again can wrap around the forelimb and keep that frequency localized if that's what you're looking to achieve. So there are other options with plate positioning, but in most cases you would be attaching to the sternum. So over the 4 years and new people buying INDIBA, there are lots of questions we get asked that I thought it was just easier to answer. Write down what is frequently asked, and then hopefully it will give you an idea. So one of the most common questions is about injections. So I don't know how popular steroid injections are in Germany. It's used quite widely in the UK, and you can use INDIBA alongside them. With regards to injections, you can treat as soon as the injection site has closed, so probably the same day. However, the vet would usually advise a bandage and an overnight stabling. Personally, I tend to wait 2 to 3 weeks, because I strongly believe you should really do one thing at a time. So if you're going to use the medication, allow that to settle, allow the horse to, see how that's working, the owner and the vet to see how the medication's working, and then you can treat with INDIBA after those 2 to 3 weeks, and you will know the effects of the medication and you will know the effects of INDIBA. If you do everything at once, you wouldn't necessarily know which bit works the best and how it's affected the horse. The next question is how often can I treat? You can treat daily with INDIBA in almost any situation. The way I tend to practice is with acute injuries. If you are able to see the horse every day, if you have the horse in practice in a clinic or a rehab center, and you can treat every day, then you can treat subthermally daily, and you can start to increase that temperature as you see fit. With chronic issues, and you are wanting to add heat, so a real thermal effect, I personally like to leave 2 to 3 days in between treatments. So again, the tissue has chance to react to the heat and the radio frequency, and then settle down again before you then put more heat in. But there are practitioners who will treat every day and they've had good results. It's entirely up to you how you want to use it. I run quite a busy practice. I realistically can't get out more than twice a week, sometimes once a week, to see a horse. So that's how I've based a lot of my work and had really good results. And then course duration is another one we get a lot of questions about. How often do I treat, and how long is a course? The clinical studies for arthritis and tendon injuries suggest it's 2 treatments per week for 2 weeks, then 1 treatment a week for 4 weeks. If it's a tendon, you would do an ultrasound scan before and then an ultrasound scan after. Again, like I said, if it's really acute, you can go subthermally daily, and you can just keep going until, say, the swelling has gone down, the heat has gone down, and then you can start to extend your time. As I said, realistically, most therapists can get to a patient once a week if they are going out to the client's house. If they are running a rehab yard and the patient is in practice, then you can obviously treat much more frequently. In most cases, osteoarthritis, I will start with a 4 to 6 week course, and then a maintenance course, which can then go monthly. With tendons, like I said, you can do the 6 week course, and then after the scan, see where what healing has occurred and what you need to do after that. And that you'll be guided, but most of the time I would go to a 2 week treatment plan and then a 4 week treatment plan until you've achieved what you want to achieve. Another question we often get asked is, can I treat multiple areas in one session? The answer is yes. You cannot overtreat, but the question is why would you? We're always trying to get to the root of the issue, find out, what was the primary issue and which bits are the compensatory issues. So if you do treat several areas at once, you probably won't know which bit is responding the best, which area responded the best. So you can treat, but I would try and treat one area at a time and see how they respond. Can I use ultrasound gel? Another one. I would say no. The INDIBA and all its research has been done using the gel, the INDIBA gel. It is a different makeup and it is designed for radio frequency. Ultrasound gel is designed for ultrasound. It's a different energy that is passing through the gel. And according to Professor Tim Watson, the ultrasound gel will make the treatment less effective because the gel will absorb some of the energy. The INDIBA gel has a higher saline content. It is better for conduction, and you will get a much more continuous treatment rather than losing connection. The other thing that has been found with ultrasound gel is when you're using INDIBA, the electrode that the active electrode will heat up, and you will be able to feel the temperature the horse is feeling. And it has been noted that ultrasound gel can block that heat feedback. So your electrode might feel cold, yet the patient is feeling the treatment is really hot. In humans, they can tell you. In horses, they can't. Can you treat on anti-inflammatories? You can, but it does tend to, you will need to treat for longer. If you are looking to add a thermal effect, and you want to almost put the tissue back into acute so you can help with the healing pathway. If the horse is on anti-inflammatories, what you might find is that the anti-inflammatories will contradict INDIBA, so they will fight against each other. When I have a horse that's on anti-inflammatories, if it's a short course, I will allow it to finish that course and then I will start my INDIBA treatment. If it's on a long course or it's an older horse with ongoing arthritis, I think it's worth seeing if they can reduce the dose and then you treat. You will have an effect, but if they're on a high dose, it might not be as effective. And can I treat on antibiotics? Depends where they are in their treatment. If there is a systemic infection, I would certainly not treat. If it's for a localized infection and you're coming to the end of the course, there should be no reason why not. But that is my personal. As far as research has gone, I believe there aren't contraindications to treating on antibiotics. Okay, so I put together some case studies just to show you some of the horses I've worked with and some of the cases that we've had great success with. So the first one is actually my dog. He is a 12-year-old Labrador who just before Christmas, he got kicked by a horse right on the sort of gluteal bicep muscle. We went into the vets to check there was no break. And after he was cleared of that, I started INDIBA treatment within 24 hours. I started off twice a day because it was my dog. He was at home, so I could treat him in the morning and in the evening. And I treated him with a very low non-thermal percentage. So it was very, very low in heat. And then I moved to once a day for 7 days. and we just continued until we started to get through the swelling. There is now the sites I treated, as you can see, are over where the dog was kicked. I also treated on his feet or through his digits, because the swelling, as you will see shortly, traveled all the way down his leg. So I was working at the lowest point I could to send the frequency up and to try and activate the lymph nodes to help with drainage. So you shall now see the first video is of my dog 2 days after he was kicked. So hopefully this video will come through shortly. Okay. I'm hoping you can see that, and then we will move on to the second video, which was 6 days later. And then the third and final video was taken because he loves to carry horse feed buckets, and he wasn't doing that. And so I decided to take that video, and that was taken on the 1st of January. And that was him almost back to full health, as much as a 12-year-old Labrador is. So this is just a time scale of him. So it was the 19th of December, there's a day he was kicked. He was kicked in the morning, and this was in the evening of the 19th of December. By the 21st of December, all the swelling had gone down his leg. Where you can see the black skin, that is all bruising and swelling. The actual swelling continued along his stomach line and down his right front leg as well. And then on the 30th of December, this was how he was. So, I mean, I find that remarkable that in 11 days we went from that to almost being back to normal. I thought we would be having problems for months, for certainly weeks. So yeah, I think that's such a great advert for INDIBA. And he absolutely tolerated the treatment, no problem at all. And he is absolutely fine now. Okay, splints are a really good one. We've had several practitioners with great case studies with splints. They are obviously a problem if it makes the horse lame. In this particular case, this was a show horse. So we wanted to reduce the splint as much as possible. It was over a 10-week period, and I was treating once a week with a mixture between thermal and non-thermal, depending on how the leg felt. So I started thermal. The next week I went back. If it was carrying some heat, I would then treat a lower temperature, and then I just worked with the leg as I found it. And the owner managed to get the horse back in the show ring, and although you can still see there is a slight lump, a big horse show in the UK, the judge didn't see it, so he was really happy with that. And going forward, we've had lots of great case studies with splints. I had one actually at a racing yard the other day. The horse had been quite lame with splints that were forming, and I only did one treatment, and the horse was sound after one treatment and actually won its race very, very well. So it when it's very acute, it can have such a great effect on splints. Tendons and ligaments, we have hundreds of success stories with tendons and ligaments. This particular horse, 11-year-old hunter mare, she was lame off fore and a lot of heat in the hoof. The initial ultrasound scan showed strain to the straight sesamoid ligament, as well as fiber disruption. enlargement and effusion of the distal digital flexor tendon sheath. We have been doing weekly INDIBA treatments from the 8th of November, and I focused the treatment as low as I could go around the heel. On the 14th of December, a second opinion vet was brought in because we weren't really seeing what we wanted to see. We felt that she should have started to improve. We also detected that the horse had some inflammation around the coronet band, and they were concerned about side bone and bony changes in the foot. So we have included the coronet band into treatments and continued INDIBA treatments weekly. On the 4th of January, the x-rays showed new side bone is developing, but the horse is now sound. The navicular was good. There was still a little bit of heat, but it's certainly coming down, and the original ligament injury is healing really well. So it's been a reasonably long process because of the bony changes, but the vet is really pleased with how she's responding, and we've done that alongside some corrective shoeing. This case was a hematoma. It was a race horse that hit a fence with its elbow, and as you can see, had quite a nice hematoma just around that elbow joint. Initially about 3/10 lame and reluctant to extend the forelimb, really sore to touch, and some heat. We treated 24 hours after injury. I wouldn't have been able to treat directly over the hematoma, which you'd have needed to do if you were using some of the other modalities. So I could treat below and send the frequency up and through. This horse became sound after one treatment, and it was resolved after 3 treatments over 2 weeks, and the forelimb range of movement returned to normal after 2 treatments. So that was a great result. In racing, which I'm sure you're aware, it's any kind of medication they try and avoid because of blood tests. So by using INDIBA, we can just avoid that, and so there's never a worry when the horse goes to a race. As I said earlier, tendons, I mean, we have hundreds of success cases, a lot of cases where horses have been told they'd need to retire, they couldn't go back into work. We realistically would see a horse at the subacute phase. We wouldn't see it straight away because the vet would go in first and treat the horse and scan it. And so we would probably go in, maybe a few days later. But if you've still got some heat or swelling, we will start quite low and then start to increase the temperature just to help with restructuring of the fibers. I always treat quite low down. So with this case, I would treat around the fetlock joint and send the frequency up through the leg. As always, we're always looking, to work with the farriers to improve foot balance. And the only tendons I've had in the 4 years that have re-injured have been horses that have had really poor foot balance. But it's been a real battle to correct with the vet, with the owner or the farrier. So those are the only I've had, other than those couple of cases. All my tendon injuries all the horses have returned to full work and to the work they were doing previously. So suggested protocol for that is, as I said previously, two a week for 2 weeks, and then 1 a week for 4 to 6 weeks, and then rescan and see where you are, and then continue treatment if needed. Just with the tendons, the longest I've ever been treating a tendon for was 12 weeks. That was spread out over a period of time after that initial 6 weeks. So I think it was about 10 treatments in total that the horse had, and then it was resolved. And that owner had bought another horse because she would never thought she would be able to ride this horse again, and now she has 2 horses to ride. Kissing spine, obviously very common in a lot of horses, certainly in a lot of race horses. This particular horse, he'd been going okay, but he was underperforming and quite grumpy. They thought about retiring him. As a physio to palpate his back, he always felt okay, could be a little sensitive, but didn't really shout that he had real back pain. But we decided to x-ray him, and he did have kissing spine. So he had an operation in January 2022, and he is back in full training now. We have regular INDIBA treatments over his glutes and his lumbar back, generally around a 5 to 6 out of 10 heat temperature, and with 1 being cold and 10 being hot, so sort of midway, nice sort of warmth. When I did this slide, it was his last 6 runs. He had either won or been placed, and he's been jumping much better. He has since won again since I did this slide, and he's just a different horse to ride. So, you know, that's working alongside the vets with the kissing spine operation, and then we manage him and manage all his other compensatory issues. Wounds, now these are actually a colleague's images, and this was of a youngster that my colleague works on a stud, and these were 2 youngsters turned out together, and they decided to run through a fence. So it was essentially a rope burn injury that was complicated with infection. Horses were on antibiotics. They did a 9-week course, treated daily for the first 10 days. The horse was kept at home, so quite easy to do, and every other day for a week, twice weekly, remaining for that 9 weeks. And she was doing the capacitive for 5 minutes and the resistive for 8 minutes, and a very low start, so 1 out of 10 heat, until about week 4, where she increased it to 4. Because this was a youngster, I think it was about 18 months old, she was quite cautious with putting too much heat into the joints as well, so she kept it quite low. But as you can see, that scarring healed really nicely after 9 weeks. And this was the other horse that also ran through the fence, and she actually did a 10-week course, but very similar. Started off with a very low temperature and increased after sort of 4 weeks, but also kept reasonably low because they are young bones, open growth plates. In this one, there was some concerns about proud flesh, and the vet was scheduled an appointment to debride, but that appointment was cancelled as there was no need to do it. You can see clear increased vascularity in that tissue, and a return to health. Both horses were sold at the sales with a full clean vet certificates, and no vet picked up the scar tissue in either of their legs. So, you know, for them, that was a really great result. So just to finish up with, I was asked just to ask a couple of my clients what they felt about INDIBA. Levi Hunt is a dressage rider. He rides to Grand Prix. He's an international rider for Great Britain. He's a coach. He's been Young Professional of the Year. His feedback, and this is his words, the most notable difference I have found on multiple horses treating with INDIBA is the depth the treatment can reach. So getting really into those deep muscles. Horses that have stiffness through their back or neck feel so much more supple after treatment, and often find they can use their hind limbs in a much better way, and much better if they're not treated with INDIBA. So he's noticed that. He noticed it particularly with one of his older dressage horses that was getting quite stiff, and he felt a huge difference, and he didn't have to spend so long warming the horse up to get to the suppleness he wants to do a dressage test. Alexia Robinson is one of my hunting clients. Her horses, she used to point-to-point train, as well as she rides herself and does a lot of hunting. She thinks INDIBA is brilliant. She feels it's transformed her horses in both maintenance and fitness, as well as treating acute and chronic injuries. In fact, the mare with the sesamoid ligament injury is hers. It's her go-to treatment for all physical concerns, and the results speak for themselves. She thinks it's an absolute game changer in horses' physique, and she really does value it. Phil Shield is a show horse. In fact, he was the client who had the splint that I showed you, the case study. He's worked with horses throughout his life, and feels INDIBA is the only one he really trusts to make a difference with horses. And he has seen so many different forms of electrotherapies through his time. The feeling I get from the horses after INDIBA treatment is something I've never experienced after laser, shockwave, ultrasound, or TENS. Young horses feel really relaxed, and those with joint issues feel like they can load their back end and feel a lot softer in their contact. And the effect on splints have been hugely surprising. Martin Keithley is a racehorse trainer. He trains not far from me. The biggest benefit, he says, is not having to medicate his horses anymore. Before we started using INDIBA, joint medications were used quite regularly on the yard to keep horses sound, but it is always a risk because if they're picked up on bloods, then they get disqualified. So he has always wanted to move away from using steroids in their horses. And since we've been using INDIBA, he hasn't had to inject any horses. And certainly in the last 3 years, he hasn't injected any horses. We just use INDIBA. And the vet would agree that the horses don't need it. So it's not just us saying don't use it, that the vet would say we don't need to use it anymore. It's a huge help for performance, especially the older horses with the wear and tear in joints. Many returning to winning after a course of treatment and then regular maintenance. They have a few that struggle with their back, some post-op, some management. INDIBA plays a significant part in keeping these comfortable and able to really stretch out and jump better. And obviously tendon injuries are always a constant worry, and we just keep on top of those that have either had injuries or those that might, there's a concern that there might be something, and we keep on top of those, and fingers crossed. We've had brilliant results so far with all his horses. And finally, Max Comley, who is also a racehorse trainer that I visit regularly. I go into the yard every week, and they notice a visible difference in them physically and helps them stay constantly sound from season to season. It can target deeper than anything else, and it really can help speed up recovery times and prevent reoccurring injury. And he's noticed that. He's also very, very flattering for me. Obviously, I go in regularly. I know the horses, and I have seen that actually he has had a lot less injury and issues since we've been working on a course of treatment for the horses. So that's it. What I do want to say is that in 4 years, there hasn't been a horse I can't treat. Some people worry about the wires because you do have to have the long wires coming to the horse, but there's been no horse that I haven't been able to treat. And even the ones that are a little bit grumpy really do enjoy the treatment. And once they've had it once, they're almost queuing up to have it again. So it's a treatment that they really enjoy, and I hope you can see from the presentation that it is very effective. So that's all from me. So I shall hand you back to
Hi. Yeah, thank you very much, Hannah, for your lovely presentation on your daily work with INDIBA, with the radio frequency technology. I think you answered already a lot of questions during your presentation, but we have 3 more questions. I would like to start with the first one, and it's how closely do you work with the veterinary surgeons, and how receptive are they to you using INDIBA?
So in the UK, we have to work under the Veterinary Surgeons Act, which means that unless it's just maintenance, we have to have veterinary consent to treat a horse. So if the horse has a tendon issue, we would always go to the vet and check they're happy for us to start treatment, and then work with them with regards to scans. So I'm lucky, because I've been a physio for so long, I have a really good relationship with the vets around here. I treat most of their horses if they have their own horses. So yeah, we work really closely with the vets, and we have to by law as well.
Okay. The second question is, how well tolerated is it for horses around their coronet and their lower limbs?
Absolutely fine. Some horses might start off and move about a bit, but to be honest, they only really start to fidget if it's too hot. So as soon as you turn the temperature down, they're absolutely fine, and there hasn't been a horse that I haven't been able to treat. Some are more sensitive to the heat, even if you don't feel the electrode is that warm. Some just tell you it's a bit too warm. So yeah, they tolerate it absolutely fine. There's no concerns.
Perfect. And the last question is a little bit more technical. All your pictures show the use of the resistant head. When do you use the capacitive head?
So I get asked this. You use the capacitive head first to warm and stimulate the superficial tissue, and then you use the resistive head. The reason that I have most of my pictures with the resistive head is because I often forget to take pictures, and I remember when I'm halfway through the treatment. But you would always start with a capacitive treatment. They generally work about 1/3 of your treatment time capacitive to 2/3 of your treatment time resistive. So if you were treating an area for 15 minutes, you would do 5 minutes capacitive, 10 minutes resistive.
Okay, perfect. Thank you very much, Hannah.
Okay.
I think there are no more questions. In any case, I probably can speak in German now. Wenn Sie weitere Fragen haben, dann können Sie die natürlich gerne auch an uns stellen. Sie erreichen uns entweder über unsere Website www.physia.de oder einfach per E-Mail an die info@physia.de. Ich möchte vielleicht noch erwähnen für die Tierärzte, die auf die Equitana gehen, dass wir dort im Rahmen des Kongresses einen Stand haben, der Nummer 47. Und da haben wir auch das System von INDIBA, den EQUUS, vor Ort. Und dann kann man den live sehen. Die Bruna wird auch da sein. Und dann können wir auch dort Ihre Fragen beantworten. Jetzt bleibt mir nur noch zu danken einmal an die Bruna und an die Hannah für diesen tollen Vortrag und das tolle Webinar. Im Anschluss daran, glaube ich, gibt es eine Aufzeichnung, die den Teilnehmern zur Verfügung steht. Die können Sie sich sicherlich downloaden. Ansonsten, wie gesagt, kontaktieren Sie uns bei Physia. Und dann danke ich allen für dieses tolle Webinar und wünsche Ihnen allen noch einen schönen Abend. Bye-bye. Ciao. Thank you very much, guys.
Thank you, Hannah. Thank you, Holger. Bye-bye.